Welcome, everyone. This is Sarah from CureSMA's Family Support Department. We're so glad to have you join us for CureSMA's first physical therapy webinar series presentation. We've launched this program to provide valuable information on home exercises, all shared by licensed physical therapists. Be sure to have the resistance bands that were mailed to you out and ready to learn today. Thank you so much to our presenting sponsor, Biogen, and supporting sponsor, the Luke 18-1 Foundation, for generously supporting this series. We appreciate all the questions that we received in advance of this webinar, and we'll try to answer as many of these as we can during the presentation and Q&A. You're also able to submit questions throughout the webinar using the questions box, which you'll find located in your GoToWebinar toolbar. Please note that all lines will remain muted during the webinar, other than for the speakers. If you have any additional questions after today's presentation and Q&A, please contact the Cure SMA Family Support Team at familysupport@curesma.org. We would now like to welcome our speakers, Leslie Nelson and Tina Duong, who will be sharing their presentation, Adult Discussion on Home Exercises with a Physical Therapist. Tina and Leslie?
Great. Okay, thank you so much. Leslie and I have been really looking forward to this session. We hope it's informative. First and foremost, we always like to start with kind of this quote because there's a lot of you online right now because as Dr. Butler said from the National Institute of Aging, if exercise could be packaged into a pill, it would be the single most widely prescribed and beneficial medication in the nation. The good news for you is that we do have something, these lovely bands, but we do not have an exercise pill for you. So it's going to take some work on your end. That being said, I want to give you an overview of what the goal of this talk is. It's really more of a conversation piece, so we'll have some Q&A at the end. But we want to provide you some basic exercise guidelines and options to support an active lifestyle that is feasible to do at home, especially with the bands that Cure SMA provided those of you who joined the call. When we look at the new challenges in this new era of SMA, we know that with the new therapeutics, patients are acquiring new motor milestones that they may not have obtained before. And this may look different in the adult arena. So we need more data on the effects of exercise, on how it may impact the disease trajectory, as well as the combination of treatment and exercise, how that combined effect could help improve motor function. For some patients, novel treatments may not be an option. So it's crucial to make sure that when you're focusing on exercise, that it's based on your goals and function. And we're trying to help manage the secondary effects of a sedentary lifestyle or atrophy that may result in motor function decline. Okay. In basic exercise prescriptions, of course, the first thing foremost, like you hear on every exercise video, is make sure that you consult with your physician to ensure that it's safe to start an exercise regimen, especially with your cardiologist, just in case there's any kind of exercise intolerance. The exercise program, as we'll talk to you about a little bit further, should really encompass flexibility, which is stretching and range of motion, endurance, which is a cardiovascular piece of things, and then strengthening. You'll notice that Leslie and I will talk to you about strengthening, but in ways that you may not think of. We're not always talking about pumping iron. We all have different ways of strengthening depending on how strong we are in different positions. Okay. And of course, avoiding fatigue and overworking muscles. If you have SMA, you know full well that fatigue is very impactful on the ability to maintain endurance and your quality of life. So we want to make sure that we work with you closely so that you don't have fatigue or overwork syndrome associated with your workout. And this is usually moderated by the intensity. So we'll discuss with you a few ways to monitor intensity. And of course, with SMA, whether it's cardiovascular or strength, that you want to have moderate intensity exercise. And we'll talk you through how to do that that may be most beneficial for you. And then, of course, we're all rare, special diamonds in this world. And so your exercise have to be very personalized. And we'll give you an example of an exercise calendar that will not only help you to track the exercises that will be beneficial for you, but also to provide your physical therapist, your personal trainer, your caregivers, your other clinicians, so that everyone's aware of the current activity level activities that you're doing, just in case modifications are needed. Because with exercise, like anything else, it's a dynamic process. It's not one static prescription. We change on a daily basis. And so our goal is to give you the resources to be able to modify and adjust as needed. Okay. So again, the different types of exercises, I have stretching on the upper right hand because we're not talking about that today, but that is incredibly important in the ability to move your muscles. We're going to talk about endurance and cardiovascular training and give you some examples on how to use the bands that were provided to you. And when we're talking about cardiovascular, we're really talking about low resistance and high repetitions. Okay, and you can use the bands in different ways to provide that type of exercise. And in regards to strengthening, that's the same case. You can also use the bands for this, depending on how taut or how loose you may have the bands. Okay, and usually strength training is high resistance and low repetitions. And Leslie will go through some of the details of what that means. Okay. Let's see. I can't remember when I'm handing this off, Leslie. Um, so in training for exercise, we typically follow what we call the FIT principles. What that means is looking at frequency, intensity, time, and type. Frequency is how much you do it. Intensity is how hard it is. And so you can do it through the rate of perceived exertion, or you can look at your heart rate max. Leslie will go into that in a little bit more detail. Time and what type of exercise that you are doing. Okay. And we do base this on the physical activity guidelines for Americans. And in this guidebook, it does show that adaptations of exercise is absolutely okay. It talks about chronic exercise or people with chronic conditions, how much exercise you should participate in a week. Don't be too afraid of what it says on here. The recommendation is at least 5 hours of aerobic activity a week and 2 times a week of moderate intensity strength training. But the take home message here is do as much as you're able, whether it's 10 minutes a day. The most important thing is to get out there and start something and do it in a consistent manner. Okay. So when we're talking about intensity, we want to talk about the rate of perceived exertion. You can see here in this chart that it goes from 1 to 10, right? Earlier, I mentioned that you should work in the area of moderate intensity. And so that would mean this zone of orange and green. Okay, so that's 5 and 6. You shouldn't go greater than this, whether it's cardiovascular or it's strength training. And then if you're looking for your heart rate maximum, it should not be greater than 64 to 76%. And if you, those of you on the online, if you'd like to learn how to calculate that, we can talk to you through that as well. Or you can Google it. It's pretty straightforward of a 220 minus your age. Okay. Endurance and cardiovascular exercise. Aerobic exercise can be, there's a lot of ways to look at this. It could be using a motorized device to assist in the endurance activity, whether it's a treadmill or a stationary bike or swimming. Not everyone has access to the pool, and so there's a lot of different devices out there that may help you be able to get the movement and get a cardiovascular exercise. Other assistive technology devices and braces also help in assistance of the exercise goals, whether it's supporting the joint to ensure that you have good biomechanics and it's safe to perform the exercises, because the most important thing when you're exercising is the quality of the movement. And so that's where the expertise of your local physical therapist can really help you learn to activate some of the muscles that maybe you haven't used in a while. And then on top of it, do it in a safe manner so that you're not at risk of injuring yourself from any kind of repetitive injury. Okay. And whether it's endurance or strength training, we always emphasize core or proximal stabilization because if you have a good base in for your arms and legs to function from, it is you can get more out of your workout and it's safer. Okay. When we are looking at strengthening, what we typically recommend in the progression rate is isometric to concentric to eccentric. And that's isometric is the easiest. And what that means is if you're looking at your biceps, okay, isometric means that range of motion doesn't move. Okay, so you're staying at this one range and you're pushing or pulling, and there's no movement of the joint. Concentric, if we're looking at the biceps, is when your muscles move toward like biceps, your elbows are flexing. So this is concentric. Eccentric is controlling the motion. When you think of eccentric, anything that controls, resolves, re, involves eccentric muscle activation. So if I'm looking at my biceps and I'm controlling it on the way down, that's eccentric. And so all of this still works in a strengthening pattern. And it's all functional because for us to be able to do our activities of daily living, we go through these processes of a muscle activation. And again, the most important thing here is stabilization, appropriate activation of the muscles as needed through the range of motion, and of course, be very careful of the compensations that you're used to doing. So I think establishing an exercise program is always good to start with a physical therapist who can show you the good quality movement techniques prior to doing it at home. Now, I'll talk through a little bit of the exercise bands that you're using here. So what you have is this box right here. I think in the box you have a yellow, red, and green bands. The yellow one's the light one, the red one is the medium, and the green is the heavy one. So based on what your needs are, you may use one or both or all three during your exercise routine. Okay. When we talk about the length and tautness of the bands, allowing more slack if the exercise is too difficult will be helpful. And if you're a little bit stronger, you can make the bands a little bit more taut. Okay. Um, So now I'm going to quickly go through a few videos. So Leslie and I will talk through some videos here on trunk stabilization. And this is really important. You can do this in side lying. So here with trunk stabilization, one of the things you can do is your caregiver can have their hand underneath your back and asking you to push down on your back. Okay. And pushing down gets you to stabilize the muscles. Okay. Also here, you can use kind of a visual technique where you can arch your back and then the ball will roll up and then you can push down on your back and the ball will roll down. And when the ball is rolling down is the feeling that you want to get whenever you're trying to do trunk stabilization. So you could see here at the beginning, I'm making an example of a triangle. And in that triangle, you want the ball to point down because when the ball goes down, you're stabilizing at the low trunk. And so I recently learned this in a Pilates class that I thought was a really nice visual trick because most of us have a really hard time trying to activate the pelvic floor and the lower abs. And so that gives you kind of a trick at home to try to do to practice that activation. And so, based on the standards of care on rehab goals, what the standards of care says for those who are not able to sit up by themselves, the primary goals is to optimize function, minimize impairments, as well as optimize the ability to tolerate different positions. Okay, and activities that you should focus on include trunk and head stabilization, gravity eliminated strengthening. So we'll see that in some of the videos, aquatic therapy, as well as chest physical therapy. Here you'll notice that this video, it's focusing on the shoulder and the back. So here we like to show some stabilization. You can do it in side lying. So here I'm having this young lady, her name is Tilly, activate her shoulder. And what a lot of times that patients with SMA tend to do is elevate the shoulder. You see that whenever I ask her to squeeze her shoulder blades together, her shoulders go up. And so here, what I'm doing is cueing her to pull her shoulders down, okay, and squeeze her shoulder blades together. Okay, so that's really what she's activating, and my hands are just cueing her to do that. And that's really functional because it translates to things such as this, where she's pushing down on her shoulders and then moving the ball. Because her typical compensation, as many of you probably do yourself, is to hike your shoulder up and then move the ball. Okay, and so this is good quality of movement that you'll notice on you should do on some of the exercises. Okay, so then I'll show this one to Leslie.
Yeah, thanks, Tina. So what I would say about this exercise is also looking at the ability to work on resistance with rolling. So you're really working on your trunk musculature as well as you're having to stabilize with your arms. And so you're getting some different strengthening with one exercise. What you'll see if you'll play it again, Tina, is that the angle of your direction of force is going to affect how difficult that roll is or how difficult it is to hold with those arms. So you'll find that playing with different angles of holding the TheraBand may adjust the resistance a bit and make things easier or harder on you depending on what you really are needing for that particular motion. The other thing I would tell you is if you don't have someone to hold the band for you, you can do things such as looping the band and putting it into a doorway, different things so that you're stabilizing the band. You just want to make sure that it's nice and stable and it's not going to pop back onto you. So that's an important thing to think through. So that's one example of additional trunk stabilization. And then the next video is focused more on just upper extremity strength and looking to see, now we're working triceps. So the band is a bit tight and she's having to work pretty hard right through her full range of motion. And it's difficult for her to get her elbow all the way extended because it's tighter there at its end range. Now, if I let off of that band a little bit, which I will in just a second, you'll see that she's able to move through that range a little bit more. And you'll see that with, now we're working the bicep. So the TheraBand is very tight. She's able to move through that first few degrees of motion. We put some slack into the band. Now she's able to move through her full available range of motion. And again, you adjust as you need. You want to work within those perceived exertions that Tina mentioned. So you want it to be challenging, but not overly so. So you do want to work through, remember those perceived exertions that you want to work through.
Yeah, great. No, I really like how you showed the range of motion, full range of motion being activated based on how taut you control the band there.
Yeah. So, and then I think you have a really nice example of how we can use the bands here for lower extremities to help support the weight of the limb.
Yeah, so here on this video, many of you have also asked us to demonstrate for, if you have difficulty moving against gravity, how can you use the bands as an assist? And so don't think of the bands only as resistance, but you could see here, I'm holding the band to kind of take away the weight of her leg, and I'm asking her to flex her knees. And this gives you a kind of a top angle view here. Right. And so as we know with SMA, you tend to be stronger on your muscles that are able to flex your knees, and it's harder to bring your legs out. And so again, in that same idea of graduated assistance throughout the range of motion, your caregiver can definitely help with that. And if you don't have a caregiver, if you have something that you can hang the TheraBands on, it can still act as the pulley system that I'm acting as on this video. Okay. Next, we'll go through a few videos of sitters. And just to remind you on the standards of care, for sitters, the rehab goals are to prevent contractures and scoliosis, maintain, restore, and promote function. Okay, and some of the exercise activities that may be associated with this are general conditioning exercises with or without resistance, and working through that full range of motion is very important functionally. concentric and eccentric exercises, and this can be done against gravity or in a gravity eliminated position, as you'll see in some of the videos. And of course, integrating aerobic exercise as much as possible. And this may be swimming, wheelchair sports, assisted hand cycling. There's a lot of creative ways that you can learn from, particularly the SMA community, but also with your therapist. And then, of course, they promote supported standing if you have the range of motion and don't have too many contractures that will prevent you from being able to stand without too much pain. But standing is also supported for 60 minutes or greater, 3 to 5 times a week. Okay. So in this video, we're really looking at some head control. So we talked about the focus of isometric head control, as well as, functionally, you need to have some concentric control. We're looking at doing some chin tucks here. And so here, to activate the cervical muscles of the spine, we're asking her to tuck her chin, and then once she tucks her chin, she holds it. And what you can do is increase the intensity of that exercise by integrating the range of motion. And so you can see my hand is on her chin to support her chin so that her head doesn't fall down. And so you can increase intensity by increasing the amount of time that she holds that position, and then the range of motion that she's actively able to rotate.
On these exercises, these are similar to the exercises you saw lying on the back. Again, working biceps here. You can do alternating kind of elbow flexions, bending at the elbow, and trying to work on, again, the resistance that you use by making it tighter or making it easier. Then I believe you can go ahead and go to the next one if you can forward through.
Yep. Sorry about that.
Yep, thanks. So now this is elbow extension, working on the tricep, which is going to be a little harder for you just because of that muscle imbalance that Tina mentioned. So here she's working through mid-range, but then we can take the arm off of the armrest so that she's able to work through her full available range. Again, just kind of showing the concept of how tight you hold that is how difficult it's going to be, and thinking through how you want to work through that.
Great.
And then next, go ahead.
And keeping in mind that biceps are typically stronger than triceps. And so keep in mind the TAUT principles that we talked about earlier. Okay.
Then looking at shoulder strengthening, this first exercise is looking at the external rotation, or moving the hands out away from the body and trying to work on the stabilization of the shoulders. And while she may not have a lot of movement there, you are still getting, that may be more of kind of some isometric hold that Tina mentioned. Remember, you're holding against resistance, but you may not be moving through the full range of motion. And then Tina has a really nice exercise, the next one, looking at the opposite direction. She's pulling in toward her body. And then the other thing that I think we should mention is that pull that Tina has when she's actually helping her externally rotate back out so that she can pull back in. So she's kind of assisting one direction and then resisting the opposite direction. And you may need that with that muscle imbalance that you may experience with your triceps and your biceps, or your internal and external rotators of the shoulder. And then Tina, you want to talk about what you're doing here?
Yeah, so you can see my hand is on her elbow. That allows her to focus a little bit more on her shoulder, because typically her elbows will go out, and so she's not in a stable position. And so we're specifically trying to work her shoulder girdle, and to do that, you may want to help someone help hold that elbow in place right there.
Now we're going to talk a little bit about, now we're working on shoulder rows. So you're working on your back stabilizers, and different shoulder muscles. What I'd like to point out here is that she's not supported in her feet, and so that may actually make the exercise a little bit harder, because now you're having to stabilize with your trunk while you're doing the rows. So if you find that it's a little too difficult to do, make sure your feet are supported so that you're not having to struggle so much to actually keep your trunk stable while you're working on your arm strength. And that's another concept just to keep in the back of your mind when you're making things harder or easier.
And also, Leslie, I really liked this one when we had the volume on. When we talked about earlier with depressing your shoulder and then pulling back to stabilize the shoulder girdle. Leslie did instruct this patient to do that whenever she was doing her rows for good quality of movement. So this video is just to demonstrate that you could do something similar in if you don't have the muscle strength as the first patient to be able to do that. You can have an active kind of assisted gravity eliminated way of doing this, also using the bands. And so you can see here the bands are holding her hand up, her arm up, just kind of like a sling, and she's instructed to pull back. Right? And keep in mind that you can do this in different ranges of motion. So this one here, she's doing it a little bit higher. If you noticed before, we also brought it down to where she's working with her elbows a little bit lower in that range of motion. So you can definitely change within how high or how low you hold the arm up to activate different muscle groups whenever you're assisting with the bands. And then earlier here, kind of in this similar manner, if you don't have someone to help at home, a lot of people have a ball accessible, right? And so she can do the same thing with Rose, having a ball supporting her hand to allow that to be a little bit easier to row. And so don't feel that if you don't have a caregiver, you can't do some of these activities, that you can definitely do some of these, having something round and kind of able to assist, right?
So we're going to move, we focused a little bit on upper extremity, so we're going to talk a little bit about lower extremity. And just like in the elbow, your knee flexors are typically going to be stronger than the ability to extend your knee. So you can see that whenever we bring the band behind the foot and trying to extend out, it becomes a little bit more difficult. So then again, you may want to work on more of an isometric hold or work through the range of motion without resistance. So here she's bending the knee against resistance and is really able to do that well. And that extension is just a little bit harder. And so working through those different ranges can be important. And then the hips are something that we definitely can focus on as well. And so Tina does a nice job here of again, showing that difference in how tight you hold the band. So when you're holding it and pushing out with your knees into the band, making it tighter around the knees is going to make it a little bit more difficult. And so it's a nice demonstration of how you might work your hip, what we call hip abductors, which can sometimes be very weak as well. Anything else on that one, Tina?
No, I think the only other thing is we also focused on her activating her trunk stabilization and kind of pelvic floor as we're doing this as well. So you'll notice in this video that a portion of it, she's really activating. You see her stomach move whenever I'm asking her to abduct her legs. And so you can kill two birds with one stone on some of these exercises as well.
Yeah, that's great. And the other thing is think about the fact that she's doing that exercise in her chair. If you are able to sit on a more unsupported surface, you're going to naturally work those stabilizers a little bit more. So the surface that you're sitting on may make a difference. And then using a ball is working the opposite muscles from pushing out. Now you're going to squeeze in your hip adductors. And again, just having something, you can even use a pillow if you don't have a ball available. So you could double up a pillow, place that pillow between your knees and squeeze as well. So there's some different things that you can use to work muscles in different ways. So we talked a little bit about those that are unable to sit and those that can sit. And then now we have our patients that can walk. And so obviously you're going to have a bit more of a available tool bag
from a standpoint of different aerobic types of exercise. So different types of swimming and walking, as well as even cycling. Cycling is something that even if you're unable to walk, there are assisted cycles, there are arm cycles, and so those are considerations as well. Yoga and Pilates that Tina mentioned are wonderful exercises to work on stabilization. Hippotherapy or riding horses for therapy works on trunk stabilization and strengthening overall. And then rowing and elliptical machines can be great from an aerobic standpoint as well. When you're focusing on strengthening, you may need to work through gravity eliminated positions for some of those weaker muscles. So what that means is if you can't extend your knee up into the air against gravity, you may need to do that in sideline, where you take gravity away from the situation, and so it's easier for you to move through your range of motion. Or you may need to do some assisted range of motion as well for some of your strengthening. And then using not only remember those principles of using isometric, concentric, and eccentric. You're making things a little bit harder as you move through that progression for strengthening. This is an exercise in standing, again, working on upper extremity, a different type of row. We're looking at shoulder extension. And same kind of thing applies here as to you want to watch for compensation, you know, looking to make sure that you're not shrugging through the shoulders, that you're keeping your shoulder blades down. But the other thing I'll mention with this is while she's working on shoulder extension, she's also working on her core stability and her standing ability. Think about the fact that it may be challenging to stay upright while you're pulling on something. And so you're getting a full body workout whenever you're working on those upper extremities. And so thinking through, again, how you might make that harder or easier whenever you're able to work through some standing activities. And then Tina has some really great videos from a lower body standpoint that I'm going to let you can talk through, Tina, as you go through these.
Yeah, so Leslie and I talked about what we'll display this in tall kneeling, but of course you could do this in standing, right? So you could tie the band around your waist and do sidestepping. The sidestepping, the one thing that we really want to point out here is that when you're sidestepping, you want to shift your weight onto your standing leg and then move over. The nice thing about this is that you're working those really essential butt muscles basically to help you stay upright. And one of the things we see quite often is not being in a nice upright position. So make sure that when you're doing this, you're squeezing your bottom so that you're in a nice position whenever you're doing some of these standing tasks. Okay. Anything else there, Leslie?
No, I think that again, the thought of the compensation and being upright is important. You do want to make sure that you're in a good position to make it, and also make it functional, so that it's something that is something that you can use from a standpoint of being able to be mobile throughout the community or throughout your home, and doing this either in standing or tall kneeling can be helpful to strengthen your hips.
And a lot of times when it comes to balance and walking, it is a matter, it's kind of like skiing. It's a matter of shifting your body weight onto that leg that's bearing all the weight. So think of it that way. So, you know, a lot of times the concept of dancing too, just shifting your weight, stabilizing, and then moving, I think is quite important there. And I think another thing to mention for those of you who want to do this, you could do this in standing or kneeling, but you can also have a table or something in front of you, or you can do it facing the couch where you have different upper extremity support, so that you can do this even if you're not able to have the core or pelvic strength without upper limb support there. Okay. And I think this other video too, we noticed that there's some weakness in the ability to externally rotate or bring your leg out. And so you can use the band where you wrap it around your thigh again, okay? And you can see the position when you're working on your external rotators on. So this is my left leg, I have the band held with my right hand, and it allows me to bring my knees out. So a lot of times that's going to be a muscle that tends to be weak. And so if you just do this, and then for strengthening, you want to do 8 to 12 reps for moderate intensity. And if you're doing it from a cardiovascular perspective, you'll make it less taut and externally rotate your legs there. Okay. And while you're doing this, you could tell that Leslie and I like multitasking. You'll notice that this also works the opposite weight bearing leg. So you works your glute medius right here while you're weight bearing, and you're concentrically working your external rotators on your left leg. Okay. And if you have a difficult time doing it in tall kneeling, you can also do what they call clamshells. And so what that is you're going to be in side lying. And again, the band is around your waist, and then you're going to bring your knees out. Okay. And that also works your pelvic girdle. Okay. And this is not limited, of course, for those who are able to walk. If you're able to do this in sitting and you're, functionally considered a sitter, you can also do this as well.
The other thing is, if the band is a little bit too restrictive or too difficult, then this is a great activity to do without a band. So if you look at what I talked about working in a gravity eliminated versus against gravity, here Tina's having to lift her knee up toward the ceiling, which means she's fighting gravity to do that. So there is a challenge if you have some weakness in those muscles, that you may not need the band for resistance. Gravity may be enough to give you some resistance to work through this range of motion.
Yep, that's great. And then this last one is also working hip extension, except for in sitting. So this is applicable for those who are walkers or sitters. You could have the band where it flexes your leg up, and then you're just going to push down. We notice that a lot of patients who are in wheelchairs do say that they feel like they're getting stronger with the ability to push their leg down. The reason why this is nice is it's functional. For you to put weight through your legs, it will help with transfers and different things that are very functional. So the ability to push down is very important. So as you're concentrically working the left side, you can also stabilize on the right side by pushing down with your lower limbs. And of course, just like all the other sitting exercises, working your trunk stabilization muscles while you're doing that.
So we've hopefully given you some ideas of different ways that you can use the bands, and also just different things around the house, whether it be a ball or a pillow or gravity, whatever that you have to work through some of the different motions. But that being said, just being able to know what to do is not always the easiest, or is the only answer. We have to actually also do the exercises and stay consistent. And then part of that is setting goals. And from a standpoint of exercise, not all of us are born to be those lovers of exercise where you just strive to go out every day and do as much as you can. Some of us are more prone to being less active. And so motivation needs to be a key part of your exercise, and it should be something that you find that it's fun. So if swimming is fun to you, if being in the water is fun to you, then by all means, finding a way to do aquatic exercise could be a great activity for you. If you're finding that the bands are something that make it challenging and that's motivation to you, then that's great. So just thinking through what really is going to motivate me to do this. And sometimes motivation can come from discipline as well. And discipline is really just having a plan and creating a habit. It takes the classic 21 days to create a habit. So maybe you set a calendar in front of you and you say, okay, I'm going to look at the next 3 weeks. And these are the days that I'm going to schedule my workouts, and this is the time that I'm going to set aside for this. And have a checklist, or have a sheet, a calendar that you're going to check off the days that you do that. And sometimes that visual, benefit of being able to see, this is what I did, this is what I accomplished, can sometimes help with creating that habit and helping with that discipline as well. And then support groups. Support groups don't even have to be official support groups. It may be your family or your friends. Maybe some of you guys through Cure SMA are able to get together and talk through, let's support one another in having this healthier lifestyle with exercise and working through some different goals. And then speaking of goals, your goals do need to be achievable. If you set goals so high that you can't achieve them, you often give up on them. You know, I will tell you, if my goal was to go out and run a marathon tomorrow, there's no way that would happen because I haven't run 3 miles in the last few weeks. And so those are things that you have to think about as far as making sure that you can set goals. And then if you need to modify them, that's okay. If you find that you set them a little too high, it's okay. Back off on it and reevaluate what your goal should be. If you set it too easy, then you need to make it a little harder and keep it challenging. And so exercise trackers may help with that, as well as goal trackers, and then even incentives. So I've heard of people, you know, I'm going to let myself go get a pedicure if I meet my goals, or different things to be kind to yourself. And I think that that's something that we all need to do in a way, is allow ourselves some grace. And if you don't meet all your goals, that's okay too. Just reevaluate and kind of think through that. And then I think on the next slide is a nice example that Tina put together of an exercise tracker. So she included those fit principles, the frequency, the intensity, the time, and the type of exercise that you're going to be doing. So you can see in the left-hand column, you're going to say, on Monday, I'm going to do cardio, and I'm going to do cardio for 10 minutes. Reps and sets may or may not apply depending on what you're doing to do cardio. And then remembering again that intensity, how hard am I going to work? And remember, you want to work through that middle ground. You want to be able to feel that you've done something, but not so much that you're overly fatigued. I often, in addition to the nice guidelines that Tina gave from a standpoint of your heart rate max and your rated perceived exertion, I often will also use the task of, if you can talk, if you can say a sentence while you're exercising, but you're a little bit breathless in trying to say that sentence, you're probably at a pretty good level. So you want to be able to talk, but still have it a little bit challenging. And then maybe the next day you work on strengthening and go through those same principles. And then sorry, Tina, then I think our last slide is really thinking through, we do want to encourage you to think through that there are medical considerations when you do initiate an exercise program. And Tina very appropriately said at the beginning of the talk that you need to establish that it's safe and feasible for you to do so with your physician. And then she even mentioned that meeting with a physical therapist to get a baseline of where you stand may be beneficial, so that you kind of know where you start and you know how to build up from there. So there are some risks as far as if you do start to work through exercises, and you do have the risk of potential injury. Then the other thing is knowing that you may have some bone fragility and therefore a fracture risk as well with some of those different movements. And knowing those risks are important for you before you start to work through different exercises. Tina mentioned fatigue, and it's something that you all deal with on a daily basis, and you probably know how to deal with it better than Tina and I can help you learn to deal with it. But knowing that is a risk if you over fatigue yourself. And then there are cardiovascular risks that again you would clear with your physician. But I think Tina and I both would say, don't let the risks scare you out of not exercising, because I hope that you know the benefits really are numerous. And those standards of care of limiting impairments, which means limiting contractures or limiting some weakness and even some fatigue. You may be able to work on endurance, and that fatigue may get better the more that you work through things. And so we hope that you find that this has been beneficial to know what to do, and then we can hopefully help you get through kind of the initiation of this and give you some ideas. So I think with that, Tina, unless you have anything else, we'll hand it back over to Kat and then take questions.
Yeah.
Great. Thank you both so much, Leslie and Tina, for such a great presentation that you shared with us all this afternoon. And really having those videos and demonstrations provided for the viewers was incredibly helpful to see the exercises. So thank you both again so much. Jessica with QSMA's Family Support Department. We have received a number of questions both prior to the webinar, but then also live as well. So to get through as many of these questions as we can, let's go ahead and just get started and jump right into the Q&A, Leslie and Tina. So our first question that we had from all of the videos and demonstrations that you've provided in this presentation, how many repetitions do you recommend doing?
Yeah, Tina, you want to go ahead? You mentioned it briefly.
Yeah, so that's a great question. When it comes to moderate intensity, for strengthening, we're looking at 8 to 12 repetitions. Anything more than that kind of falls in the cardiovascular arena. I think that's kind of the general rule. And so if you're going to increase your intensity or how taut or what bands you use, if you could do between 8 to 12, that'll be considered strengthening.
And you want to make sure that those 8 to 12 are done in a way without compensation. So if you're having to compensate to get to 10 repetitions, you're probably doing a little too much. You probably need to back off on the resistance a little bit. So make the TheraBand a little less tight so that you're able to really get through those full 8 to 12 reps in a good biomechanical fashion.
Right. I mean, you don't want to be the guy at the gym that's, you're doing biceps, or really you're just like bending your back to get up there. Your real quality is really, really important, and particularly so that you cannot have injury more than anything else, because as any of us who've had injuries, coming back from that is more difficult than preventing it to begin with.
Yeah.
Perfect. Thank you both so much. Moving right along, next question. Can you recommend any non-weight bearing exercises to promote bone health and density?
Yeah, that's a great question. And unfortunately, the way that we do develop bone and improve our bone density is through weight bearing. The one thing that comes to mind for me, Tina, and you can tell me what you think about this. The first thing that popped in my mind was weighted vests. I think that there have been some studies that look at even just wearing weighted vests through the standpoint of, even if you're weighted while sitting, you may get some bone density through your spine in that manner. So that's something that just came to mind. Tina, do you have any other thoughts?
Yeah, that's actually a good one. I didn't think of that. I was actually thinking kind of from Wolf's Law kind of perspective, that I even isometric exercise. I know that isometrics, it doesn't seem sexy in the sense that you don't feel like you're doing anything, but isometrics is hard. And if you do isometric exercise, that gives the pull on your on your bones, that also can contribute to increasing bone density that I don't think we typically think about, because we always think about, weight bearing. But so that's why, if you're in a chair or whatnot, we showed you a few isometric exercises. I think that may be helpful. And then of course, aquatics. If you have access to that, that'll be helpful. And I think if you have access to the gym, there's the cool devices like the what is it? Not G-force. Alter G, which is really cool treadmill, where it gives you much more. It simulates weight bearing and walking without having a harness, and so you can it's like being in a pool, except for you're on a treadmill that takes away your weight. So those are various options depending on what you may have access to.
Great, thank you both so much. Our next question is, do you have any stretches that you'd recommend for an extremely tight neck?
Yeah, sometimes, the neck can be tricky, and sometimes stretching can be just as simple as looking in the direction that's tight. So active movement through your available range, and then holding at that end range is something that you can do. if you have someone that can help as far as or even if you might want to, you can put a little bit of overpressure. So let's say you have difficulty looking to the left. You can look to the left as far as you can and then use your hand to kind of put some overpressure so that you're stretching through that range of motion a little bit. There are lots of muscles in the neck that can be tight. And so are you talking about just rotation that's difficult? Are you talking about being able to look up and down? So it's difficult to say just in general how you might stretch. But that overpressure after looking at your end range of motion is something that you might be able to do. In general, the longer you hold a stretch, the more effective it will be. We don't have the magic, I think a 30-second hold is kind of something that you'll hear on a regular basis. But we do know that the longer that you hold something, the impact will last longer. But you also want to make sure that you're doing that within your tolerance. And so if that longer hold is too uncomfortable, you either need to back off on how much range of motion you've taken yourself through, or hold for shorter periods of time and do more stretches. So you might hold for 10 seconds and do 10 of them rather than holding for 30 seconds and doing 3 of them. So Tina, what else?
Yeah, I think we didn't talk about it, but stretching is a key component, because if you have tightness, what you're fighting against is the tightness. So if you have weak muscles and you're fighting against tightness, it makes movement harder. I think when it comes to neck muscles, one of the things that we typically see, because it's a compensation, is this kind of stacked neck position. And so because of that, we showed you earlier the chin tucks. It functions in multiple ways. It functions as isometric strengthening of the neck, but also you're also stretching the neck. So if you can see my video here, sometimes I have my hand on my chest and then a finger here, and I'm tucking the chin back. That's really stretching the part of the back of your neck that's typically tight because you have this stacked neck that's holding your head up. So I think chin tucks is a nice one where you can either tuck back and hold. That would be really great. And I think another one too, of course, up to your tolerance, is looking at your armpit basically. And if you can get your hand up and just kind of doing a gentle pull against it, always feels nice, especially if you're looking at a screen all day. I think those would be the only things I'd add. But of course, I think with caution, because it is your neck, so you have to be very, very gentle with the neck stretches.
Great. Thank you both so much for explaining that a little bit more. Next question, it was recommended to this individual that they see a physical and occupational therapist. Where exactly would they get started, and how would they get connected to begin therapy?
It's a great question, and I think that can be the frustrating thing. Just the starting point can be difficult. And so depending on the state that you're in, you may need a physician referral to see a physical therapist. And even, I know in my state, you may be able to come see me for an evaluation, but then for treatment, we may need a referral from a physician. So a physician may need to be involved in initiating the physical therapy evaluation. The other thing I will tell you that can be sometimes frustrating is that you are going to often come into contact with physical therapists that really have no experience with SMA. And they've never had a patient with SMA. And so you may feel like that's a limitation, but what I would tell you is if you have someone that's willing to learn, you're going to be in good hands. They have the principles of exercise and understanding from a standpoint of even what Tina and I have gone through with how many repetitions and those kinds of things that you can do. But guiding them in where they can find information, for instance, on the Cure SMA website can be helpful. And then even your education of what you know about the disease is something that can be invaluable to someone who is going to help guide you through the process. So I wouldn't let that deter you from trying to find a physical therapist. If you can find someone that has experience in SMA, then that's a plus. But if they don't have experience in SMA, proceed with caution and make sure that you're an advocate for yourself and everything is as it needs to be. But don't let that limit you from moving forward with that individual.
Yeah, I think that's great. And there's some other places you can look to. The APTA website has Find a PT, and then if you're looking for, as an adult, looking for a neurological clinical specialist, they may know more about SMA than if you went to any typical sports outpatient facility.
Yeah, the other person to ask is if you go to a specialist, your neurologist, and there is a ask your neurologist if they have anyone they refer to. And then even better, if there's a physical therapist in that clinic, they may be able to help direct you to someone that they know in the area as well.
Great. Thank you both so much for sharing those resources. So moving right along, our next question, is it true that overexertion accelerates nerve cell die-off and that it should be avoided?
Tina, I'll start. I think that the word overexertion I think is probably related to that overwork or fatigue concept. And so as far as whether or not that causes the nerve cells themselves to die off, I think in muscular dystrophy in general, that's something that you do need to be cautious of from a standpoint of how the muscle might break down. From the nerve standpoint, I would say that over fatigue is not going to affect the nerves themselves. But you do want to be cautious with over fatigue just because that's when injuries can occur. Tina mentioned, if you, as far as you want to prevent injuries, and because it does make it more difficult to come back from that and build back up once you've had an injury. That would be my first answer. And Tina, you want to expand on that?
Yeah, no, I totally agree with you from the nerve perspective. I'm not aware of overexertion causing nerve damage. I would say, if anything, it's biomechanics sometimes of repetitive injuries or inappropriate positions that may exacerbate some nerve contractions and things like that, but it not actually damage the nerve. And there's when you fall under the you think about the neuromuscular clinic or muscular dystrophy, like Leslie was saying, dystrophic muscles respond to exercise very differently. And I think here we're talking about motor neurons, and we are not, at least I'm not aware of anything showing that overexertion itself will cause degeneration of them. The concept is, if for you to increase strength, you have to kind of push the envelope of what is comfortable. And we mentioned before, it should be functionally focused, because there are such things as overwork weakness, where when you overwork the muscles, and you're not able to do your activities of daily living, you went a little bit overboard. And so that's where you go back to your exercise calendar and check that, okay, well, 8 reps at 2 pounds was way too much for me. I need to back off on it. So that's where you can kind of fine tune that.
Perfect. Thank you so much. Our next question, for those currently on treatment, do you recommend them starting a physical therapy routine?
I would say
maybe
yes.
biased in this. Yeah.
We're both physical therapists, so I think yes. I would say that Tina mentioned in the introduction that we are in a new era, and we don't know the response to exercise in conjunction with a disease-modifying therapy, and so we're learning. And I would say that I have counseled my patients that that because we're learning, it's okay to start a therapy and let's see where it takes us, and then we modify as we need to, whether we need to push to keep progressing and making things better, or whether we need to back off if we're seeing any negative, if it's over fatiguing, those kinds of things. But I would say that doing disease modifying therapies along with exercise can only, in my opinion, be beneficial.
Yeah, I mean, I 110% agree there. I always tell our patients here that the treatment gives you the opportunity to improve. And so the improvement when it comes to muscle strength, when you're getting a disease modifying therapy, it doesn't happen overnight, right? And so for muscles to get stronger, there's unfortunately no pill at this time for it. And so it requires some work on your end. And just, from the patients that we see who do combine their treatment with some kind of physical therapy, there are a lot of benefits that come from that, not just physically, but mentally, emotionally. You feel much more empowered that you are getting, the most out of this treatment that you're spending so much time and effort on receiving.
Great. All right, thank you. So the next question is, how can someone determine if they are doing too much physical activity, or if they've done enough collectively for, the one day as well?
I think we've touched a little bit on that from the over fatigue concept. And if what I would tell you is, let's say you exercise today, you do your 2 pounds, 8 repetitions today, and the next day or even the day after, sometimes it's the second day after working, that you'll feel soreness to the point where it may be so sore that it limits you functionally. So let's say you were working on your biceps, and 2 days later, it's really sore to bend your elbow still. You may have overdone it a little bit and you may want to back off. So if it's limiting your function, you definitely would back off a little bit. From the other thing I will tell patients is sometimes if you've worked out that day, if you find that later that evening, you're unable to do your typical daily activities. I'm too tired to even eat my meal. I'm too tired to play with the kids. I'm too tired to watch my TV show even. Then you've overdone it a little bit and probably need to back off. So those are the guidelines I'd kind of bring up.
Yeah, I entirely agree. So what Leslie was referring to was delayed onset muscle soreness, which happens between 24 and 48 hours. It's a little bit different for everyone. But when that happens and you can't do, for example, feed yourself, this has happened to me. I get overzealous and I really literally could not get my hand to my mouth. That would mean you went overboard. And so we refer you back to tracking your intensity so that you don't want to do that again. So I think monitoring that delayed onset muscle soreness is going to be crucial in determining your own personal intensity level.
Thank you both so much. So I think we're going to do one last question, just time for one more. So do FES bikes have any benefit for individuals with SMA? And do you have any suggestions on specific brands?
Tina, I'm going to let you talk about that.
So FES is functional electrical stimulation bikes. So I don't know about home ones. I don't know if you do, Leslie, but typically it's in the clinic. And the reason for it is not so that you're strengthening the muscle. So you're not, it's not like, the movies Bruce Lee. I don't know if many of you know this, where, he put the electrodes on and he zaps himself to get his muscle stronger. Not the concept at all that we're talking about. When we look at FES bikes, we're looking at it from a neuromuscular education perspective. So sometimes, especially, you're an adult, you've had SMA for a long time, your muscles have been asleep for a little bit, and this FES or neuromuscular E-stem can wake them up and just remind them, this is how you work. And so that's where we find it beneficial from a neuromuscular education perspective. And we do highly recommend that you do this in the clinic so that the E-stem is stimulated at the time that muscle should be contracting, because it's really not doing its job if you're working on your biceps, but then the E-stem is in the back of your triceps and you're not really working that muscle at the time. So it's a mind-body connection that needs to happen whenever you're using that. I don't know if you have more to add there, Leslie, about that.
Yeah, no, the only other thing I would add is that an FES type bike is different than an assisted cycle type of a bike. And so there are cycling machines, whether it be for arms or legs, that are actually have a little bit of an assist to them so that it helps you with the motion. And that's different from the FES bike, in that that might be another option to help with working through those endurance or those cardiovascular or strengthening exercises that they're using a bike with.
That's a really good point, Leslie. And maybe that's what the person who asked the question meant. Maybe it's an assisted bike, and we're big advocates of the assisted bike. And for those of you who have grip difficulties, there are hand braces out there that you can order, where if you can't grip onto the bike, it kind of hooks your hand onto the bike, and you're still able to do that cycling with the assisted bike. So don't think that because you don't have hand grip, that is not an option for you. There's a will, there's a way, and you could talk to your physical therapist to kind of figure out the way.
Wonderful, thank you. Hi everyone, this is Colleen McCarthy O'Toole with QRSMA's Family Support Department, and we just wanted to say a huge thank you to Tina and Leslie for their wonderful presentation today and for answering all of these questions that have just come in. We're so grateful that everybody was able to attend today's webinar. Everyone will be receiving a follow-up email with a survey link, and we would love to appreciate any feedback that you have to share with us. We are also extremely thankful for the incredible support from our presenting sponsor, Biogen, and our supporting sponsor, Luke 18-1 Foundation, for making this physical therapy webinar series possible today. And please join us for the next PT webinar session on April 16th. It's called Pediatric Discussion on Home Exercises with a Physical Therapist. If there's anything that we can do for any of you, please email us at familysupport@qrsma.org. Have a great night, everyone. Thank you all so much.
Thank you.
Great. Thanks so much for having us speak.